So main clinical hall, patient hall, and then steri hall.
Got it.
So the team's always able to go.
Okay, I'm coming back to you.
The team always circulates completely without having to open a door, particularly instruments and things of that
Okay.
sort.
Yeah.
The patients are able to pretty much be split.
Okay.
Oh, you're going to go on this side of our practice, or you're going to go on this side.
Okay. Got it.
We have our team on headsets. When you get to a certain number of operatories, you have to.
Okay.
Like, what am I going to do, run around looking for you?
Right.
No. You're laughing. It's true. Where are they?
You know, you don't think that our place is so big, but yet you can never seem to find someone when you need them. I don't know why that is. I don't know.
At the very end, that's our surgical suite. Sedation. It's a little larger. Lighting changed for the hallway, so it's still visible for the team to walk
Yeah.
through, the patients, but it's also calmer.
Dude. Yeah.
We'll be in this one.
Okay.
Lights here are off. You can come straight in. I can fit like 8 people in here, so please come on through.
Wow.
Go all the way to the top of the room.
Wow.
Same Brad. So the main lights in this room are off.
Okay.
This could be for someone who might very well, yeah, absolutely. You can come around that way too. Might very well just be anxious.
Okay.
They may come in with a migraine. You're about to treat them for a particular procedure. I know lights off in many operatories or treatment rooms can feel weird. However, if you know you're going to have dental light,
Yeah.
if you know you're going to have spotlight for both of you, can you work in a space like this, lit?
I mean,
can.
absolutely. Yeah, for sure.
You don't have to have the room light. This happens to be the all-in-one room light, which would allow us to turn it on.
Whoa.
Right. But you came in with a headache,
Yeah.
right? You got to think about what the patient would happen.
Yeah.
In an everyday scenario, we turn the lights on. If you have somebody that's a little bit more apprehensive, you can definitely turn the lights off.
Sure.
Don't have to,
Francis, there is also the option for dimming too.
we're getting there.
And
So-
when you do whining, you just want the patient to
Right.
relax.
For sure. Absolutely.
Exactly.
Yeah. Yeah.
So while you saw it super high, you still have the opportunity to increase or decrease the light. And that's even brighter.
Wow.
And that goes,
Holy Matt.
so it was actually,
What do I need this for?
that light was actually dimmed. We were recently asked about the lumens of this light, between 4,000 and 4,800. So
bright.
when you're, you know.
That's bright.
Yeah.
Wow. Okay.
So the warmer you go, the more yellows you're going to get in your tones
Yes.
for your lab work. The higher you go, the more blues. We personally in downtown Boston had an upstairs ceramist that was working
Okay.
for us. He would turn on the warm light
Okay.
because what he was finding was people would come in and say, oh, but when I'm at the bar, everybody knows
So
I have
funny.
teeth
That's funny.
and I want my
Okay.
veneers to not light up. So
Yeah.
he would take the blue and take it out
Yeah.
of the mixture
Okay. Got
so
it.
that when he put in veneers, no one would ever know these were not
Got
their real
it.
teeth.
They were warmer. That's
Warmer in their
smart.
tone. Yeah, very smart. So that's what the lights allow us to do. I did mention checkout up front. You can do checkout in the back. Gets a little weird. I see the face. It
No,
gets
I
a,
mean, I have said that before in
but
other
it's a little
offices.
weird.
Yeah.
It's a little weird, right? You're the one providing a service. Why are you also collecting the check? Well, we made it weird. We just said we let people buy, pay us next week, next month, next year. Monitor allows that chair-to-chair discussion. Go ahead, grab a seat. Get cozy. It is the most comfortable chair you will ever sit in. So today we're going to talk about X, Y, and Z. This is a conversation. This isn't a, oh yeah, you have a cavity on tooth number 4. It's a discussion, and that's feels better. It is that relationship you spoke of that your patients already have with you. They've known you and your dad for a really long time. Their kids may have known you as well. Hand washing. Not every office chooses to do sinks in the operatory. Sometimes they're just doing, a pump of like a Purell. Some of them will have a sink in the hallway. Here's what I tend to say in general. Perception is reality. If you wash your hands, that means the patient knows you washed your hands. Even if you wash them in the hallway, they don't know you washed your hands.
Right.
So that's convenient for the use of hand washing in the room, but also allowing somebody to freshen up. They've been sitting back for a while.
Yep.
All reapply makeup, be able to look at their face, confirm they don't have any of those funny markings that usually happen with nitrous. Paper towel and cup dispenser as well. And in this case, we've actually covered these. They don't need to be covered. They're typically in an open setting, which is your glove storage and mask storage. These were added during COVID. We kept them on, and the team seems to be okay with them there. Keyboard slide allows me to write my notes.
Love that.
Yeah. So a lot of our doctors ask, well, do I really need to have 2 computers? Right? Well, if you're wanting to take notes on this side as the assistant, remember the Post-it conversation we had where you have to take it with your phone and walk out, you can run 2 separate units. So this is a single computer here. There's a single computer under here. I'm not going to open it. It is a panel. Panel here is for the computer portion as well as the faucet. The panel underneath is where your plugs are for the TV, as well the monitor, as well as the actual CPU that's down there. So everything's kind of away.
So your vision is actually, so I thought it was the same CPU for both monitors. It's 2 individuals.
So that depends on
Sure.
if you're looking
Yeah,
to have dual function.
got it.
And what would the benefit be to dual function? The Post-it conversation we had a little bit ago. You're trying to need to find a home to take notes.
Right.
So
Yeah.
if you have to find a home to take notes, that means you can't take them in the room yourself,
Right.
which means somebody's mouse is controlling your computer,
Yeah.
and you can't speak and work at the same time. Minutes.
Yeah. Yeah.
So it's the front desk, it's the admin minutes that do impact the patient's experience throughout. The patient monitor is really tied to the patient's experience since we jump from this monitor to this one. That's just an opportunity for them to watch. In our situation, we do like HGTV, things
Right.
of that sort. More from an entertainment perspective. Back wall, mentioned the computer storage. It's actually on Monica's side. She'll pop that door open and do a CPU right in there, and it slides out for any easy maintenance.
Got it.
And then for this side, which is usually how my assistants are coming in when they're setting things up, this has a couple of areas for bibs,
Monica.
tape. It's going to be really dependent on what you specifically use. Headrest cover. They no longer make this printer, so we no longer do a printer shelf. We just happen to have one that has just
We were
survived.
we were talking in the car about what the materials are that we need for the assistants to turn the room around. The
Yes.
storage for those items. As I said, we have cabinets on both sides. The rooms were made long ago, and most of the drawers at this point are empty.
Good job.
So they're empty. So we're debating as we kind of rebuild the rooms. We're
Yeah.
just trying to figure out exactly what we really need to have in there. So
Absolutely. Absolutely. And during training, because I get to come out to the office, or one of my team members, we spend a full 2 days with you all. We actually show the systems in use. More importantly, we talk a lot about that turnover. That is a bottleneck. That prevents the doctor, your hygienist, from getting into the room. You need to take a preliminary impression, but you have to wait for him to clear what,
Yeah.
what
Yep.
surfaces. And now you're doing a turnover and you're trying to figure out, well, how many surfaces do I need to reach? Well, if you don't have side cabinets, let's walk through it. You don't have side cabinets. You don't have the arm of the over the patient. What would this turnover be like in comparison to what you have at home? So here's
Less?
the challenge.
Yeah, super quick.
Turn on your phone upside down. Don't stare at it. And you're going to be rushing because you know that you've turned on a timer, right? That's nature. Turn it upside down, do your turnover, and don't turn it off until this room is ready for you to walk out and grab a patient from the front desk.
yeah.
I challenge you to do that. Get me the video. Not the video, get me the time, because it's not going to be video, it's going to be a clock. Like, write that down, email it to me, okay? And then at training, we're going to do that same step with a room like this. If I told you today what this takes to do, you'd say, no way. So I don't want to tell you today what it takes in this room. I want you to time yourselves, and then I'll tell you what we take to do these rooms. Is that fair? Yeah. All right. Deal. Back counter, as I mentioned, holds the TV as well. So this is an opportunity to have the HIPAA compliant monitor for the assistants use. So you guys are looking at this, right? Which direction do you face? You don't face over here. You don't face over there. You're facing here when the patient's back. So you're able to just glance up, see who's back in, tap the doctor on the leg and say, hey, enough talking about the kitty cats and the dogs. We got to get to dentistry. I'm kidding. I'm messing with you. That gives the HIPAA compliant portion. Yep. The workstation itself has a keyboard slide. And then the back wall, right? What things do we need in the room? Great question, Doc. You need the things that you use 90% of the time. Your 90% procedure profile, that's going to be different than Jonah's. He's perio.
Sure.
It's going to be different than your endo office, their endo. In our situation, we have what we need here 90% of the time, regardless if it's a doctor appointment or a hygiene appointment. Our goodie bags are made here, not 15 days in advance, where we may have picked a toothbrush color that kid now is flipping out because they don't like it.
Yeah.
So you get to give them some choice as well. The cleaners, as you mentioned earlier, any of the wipes, you always have access to a few drawers. In this particular setup here, that's for patient mirror. You want to show them something. It might be a checklist that you all have so you know how to prepare the room. And now you get to come over here and actually be in the chair. Yeah, and you get to be over here. And go ahead. I'm going to adjust you, so I need your permission to touch the chair a little bit as we're working. Ready? They're going to slide you in. It's a really cozy chair. I mean,
Be sure to give him the remote for the heat massage.
we do have a remote.
That's gonna be a problem.
Every phone heat massage.
Yeah. So, yep, you can go ahead and hit a few buttons. We put this on this side. This is the second touchpad.
Okay. Yeah.
I'm going to tell you why I don't like the second touchpad.
Okay.
You have buttons on the shoulder that allow the patient to sit back up as well.
All right.
So there's really not a need to manipulate from the assistant side.
Okay. Got
You
it.
get a lot of it out of the doctor's side. The only reason we do two is because we have enough of that left-right convertibility that we talk about. So we do the corner of the patient's shoulder right up against the workstation, which means that you get to be with your hip height roughly as you're working. Yep, that's right, Doc. And that's actually this whole day has just been the organic portion of the conversation. So that's actually what Dr. A does.
Okay.
So you did it without realizing you did it. So you backed up
Yeah.
so that you could grab with your dominant hand.
Sure.
That-
Oh, okay. Got it.
That's the trick. So when you had that concern of, oh gosh, I got to use my non-dominant hand, you just have to back up. And not everybody wants to, but you did it naturally, so you'll be fine. Yeah, you were concerned.
I mean, well, so I mean, and we've talked about this a little bit before. You know, in our current setup, I don't have that movability. I don't have the space back here. Based on our 12 o'clocks and the cart that we have behind,
Right.
This is a very tight spot. You know, I know that as we've been talking, you know, our rooms
Keep talking.
Our rooms are about 11. Oh, see, that is nice. Okay, that's even nicer. So our
wait,
rooms
there's
are.
more.
So our rooms are about 11 feet long,
Yep.
and they're cramped back here. I can't really get back here so easily. So you know, as a result, you know, I have a herniated L4, L5. I mean, like everyone else does, but you know, it's not helpful. So this is easy now. Moving back a couple inches because I have it, no big deal. Yeah.
Right.
So I see that.
So I would ask you, has there ever been a time in which you did fit back here? And I think the answer is today.
And I think it's like you're able to like move this around.
Well-
You can move it.
So like
Yeah. So and the assistant carts that we have currently, they really box Millie out.
Yes,
She can't get back into the same spot.
right.
Just based on how they're designed, and and like I said, the space that we have behind the chair.
Okay. So Millie, right now you're still really far from Doc.
yeah.
Yeah. So we need.
Just use a
Because I have the I'm so used to
The
like have
belly bar,
Yeah.
yeah.
Yes.
Yeah.
So the
Right.
reason you need a belly bar is because you likely have to turn yourself way over here to get things, and you likely have to reach way over here to get things.
Exactly.
So you're going to fall out
If I don't have that.
If
because you don't
if
have it.
Uh-huh.
Now, if you were able to sit upright like you are now, do you feel like you're straight? You look straight.
I feel straight. Yeah.
Okay, good. Let's get that foot pedal out of the way. Okay. So now
Oh
can
my
you look?
gosh.
Oh my gosh.